1. Who is considered the founder of modern nursing? Florence Nightingale. 2. The first nursing school in the world was established in which city? London. 3. In which year was the Indian Nursing Council established? 1957. 4. Which of the following is a fundamental principle of nursing ethics? Autonomy. 5. In what year did the International Council of Nurses establish? 1899. 6. The nurse should assist which of the following first? Vital signs. 7. Which of the following is a sign of infection? Fever. 8. Which medication route is preferred for rapid effect? Intravenous. 9. A patient with hypertension should be monitored for what risk? Stroke risk. 10. Which symptom indicates hypoglycemia? Sweating. 11. A nurse should assess for a sign of infection by checking what? Temperature. 12. What is the primary role of a charge nurse? Supervise nursing staff. 13. What is a common intervention for a patient with heart failure? Limit sodium intake. 14. What is the first step in an efficient assessment? History taking. 15. Which lab value is measured for kidney function? Creatinine. 16. What does a high potassium level indicate? Kidney dysfunction. 17. What is the correct way to assess capillary refill? Squeeze the fingers. 18. When was the first formal nursing school established? 1860. 19. Which position is best for a patient with respiratory distress? High Fowler's position. 20. What is the first step in the nursing process? Assessment. 21. A nurse should assess a patient for pressure ulcers every how many hours? 8 hours. 22. What does a high white blood cell count indicate? Infection. 23. What is the proper technique for taking an oral temperature? Under the tongue. 24. Which of the following is an early sign of hypoxia? Confusion. 25. The Glasgow Coma Scale is used to assess what? Mental status. 26. What is a common side effect of diuretics? Dehydration. 27. What is the most common cause of hospital-acquired pneumonia? Bacteria. 28. What is the normal range for an adult pulse rate? 60 to 100 beats per minute. 29. Which position is used for abdominal assessment? Supine. 30. What is a key aspect of patient education? Provide written materials. 31. What should be monitored in a patient receiving steroids? Blood glucose levels. 32. What is the primary purpose of a chest X-ray? Assess lung conditions. 33. What is a common side effect of antibiotics? Diarrhea. 34. A nurse is assessing a patient. What is a sign of infection? All of the above. 35. Which intervention is appropriate for a patient with a fever? Increase fluids. 36. What does a pulse oximeter measure? Oxygen saturation. 37. Which assessment tool is used for assessing fall risk? Morse scale. 38. The nursing profession began to gain formal recognition in which century? 19th century. 39. Which of the following is not a component of nursing care? Payment. 40. In what year did Florence Nightingale establish her